Cystic fibrosis is a hereditary disorder affecting the exocrine glands. It causes the production of abnormally thick mucus. Cell-to-cell communication describes the giving and receiving of signals and information with a cell's environment and the messages within itself. There are 3 stages of cell signaling. The first is reception. This is where the target cell detects a signal and there may be some binding occurring. The second is transduction. During this stage, the signal is received and is actually converted into a form that will perform the specific response. The final stage is the response. This is where the specific response is actually performed. Cystic fibrosis is a recessive autosomal disorder. If you have one copy of the faulty allele, you are a carrier but have no cystic fibrosis symptoms. To have the disease, you have to have 2 recessive alleles of cystic fibrosis.
Cystic fibrosis is the textbook image of one single mistake that can cause a huge array of serious issues. Approximately 1 in 29 individuals in the United States carry the mutated cystic fibrosis gene. Mutations to the cystic fibrosis transmembrane conductance regulator, CFTR, is responsible for 70% of cases occurring during transduction, but it varies throughout ethnicities. The CFTR protein contains 1,480 amino acids, but the most common mutation causes the deletion of only 1 amino acid. The severity of the disease is a spectrum, which has been a mystery for many, many years. Scientists and researchers have never truly known the cause of the spectrum. Fortunately, in 2010, new research emerged showing a defective signaling pathway which contributes to the disease being so severe. The new research showed that a protein called the peroxisome profilator activated receptor V, PPAR-V, is responsible for some of the most serious symptoms of cystic fibrosis. Interestingly enough, a correction of this defect, when observed in mice, reduces those symptoms.
The main causes is a defect in the CFTR gene on chromosome 7 causes this disease. This defect causes the gene to produce a minimal to very little of the CFTR protein. This then causes the main symptom of cystic fibrosis, thick, sticky mucus. The symptoms that are produced are very large. A persistent cough that produces a thick mucus is the main one. Exercise intolerance, wheezing, poor weight gain and growth, and inflamed nasal passages, just as you would a cold feel, are also some symptoms.
Some interesting facts about cystic fibrosis. Every U.S. state requires cystic fibrosis screenings for newborns. The majority of CF patients are diagnosed by the age of 2. The diagnosis is through a sweat test and a genetic test.
CF has no cure, but treatments are improving constantly. The lifespan of an average patient is 37 years old. CF is an invisible disease. Children who have CF do not have any of the physical signs of the disease, like you would not know they even had the disease.
The Cystic Fibrosis Foundation is adding tomorrows.